Welcome to Getting Understanding with Dr. Darrell Ellis. We've got a lot to talk about. I'm going to kind of go through some of the more up-to-date and latest information regarding this Omicron variant that has swept across the world and is continuing to march forward. We talked about in our last video some of the differences between Omicron and some of the previous strains of COVID-19. I want to recap some of that stuff because there's still a lot of confusion out there about whether I really may have the variant, what kind of symptoms are characteristic of it, when should I get tested, when should I quarantine, how long should I quarantine, whether or not there's treatment available for me, whether or not I should even worry about vaccination since the numbers of people who are dying from this particular strain of the variant are not nearly as high as they were with the previous strains. There's a lot out there. I have several family members who recently have contracted Omicron, and a lot of those questions have come to me personally from various family members across the country. What types of testing is appropriate for Omicron? Whether or not the home tests are even effective? Whether or not there are certain types of home tests that are more effective or more sensitive for the Omicron variant versus other types of tests? All those things are things I want to talk about today. As we go forward, don't forget to subscribe. Don't forget to click the like button and send us questions through the YouTube channel. I'm looking forward to hearing from you so that we can make this as much of a dialogue as possible, as opposed to me just kind of spewing out facts to you guys week after week. Number one, what does Omicron look like? Well, Omicron is generally more upper respiratory tract in nature. You can develop cough. Some people progress to develop pneumonia, but the numbers of patients that are progressing are much lower than what we saw in the previous variants. Most patients who we see who present with Omicron really have symptoms more consistent with sinus and allergy problems, nasal congestion, postnasal drainage, a scratchy or sore throat, low-grade fevers, sometimes swollen lymph nodes in the neck, body aches, and fatigue. Those are the main symptoms that we see. If you start developing these symptoms, particularly if you develop those upper respiratory tract symptoms of the runny nose, stuffy nose, sore throat, you need to be real cognizant of the fact that this may be the early signs of Omicron infection. Why is it so important that you detect them early? Well, we have very limited resources in terms of treatment to prevent people who have not been properly and completely vaccinated and have significant increased risk factors for more aggressive disease to intervene to prevent them from becoming very sick. So you've got basically 5 days. 5 days from the initial symptoms to, number one, recognize it yourself, number two, get tested, and then number three, get in touch with a healthcare provider who can point you in the direction of resources that are available in terms of treatment to be able to treat the mild and moderate symptoms and hopefully prevent the progression of symptoms to the point where hospitalization is necessary, and then perhaps even worse, mechanical ventilatory support, and even the most severe cases, death. Although Omicron in general does not seem to be as severe, it's still killing people. It still can progress, particularly in at-risk populations, to very serious disease, and it's still a very dangerous virus. I don't want anybody to take this thing lightly because the news reports and even some of the medical personnel who you may be hearing from are saying that it's not as deadly as the previous viral strains. And that's true. That doesn't mean that it's not deadly at all. And we need to do everything that we can to try and, number one, prevent it, number two, catch it early, and number three, keep those who are most at risk from becoming severely ill and dying from this viral infection. So, you start having these upper respiratory symptoms. See if you can get yourself tested. Now, how do we do that? I hear a lot that people who are going to testing centers are having to wait exorbitant periods of time, hours and hours in some cases, in order to be able to even get a test. And then after they get the test, it may take another 2 to 3 days before they get the results of that test to be able to confirm whether indeed they're even COVID-19 positive. If you've waited 3 or 4 days from the onset of your symptoms before you go get it tested, it may be another 2 or 3 days before you get the results, and you've missed the window of opportunity to receive the available treatments. What are those available treatments? Well, number one, there are still 1 or 2 monoclonal antibody treatments available. The problem is they're very short in supply and very difficult to get your hands on. I know at the local hospital here, we were given, I think, 5 doses of that specific antibody, and it was gone within about a week after it came out or was available to us. Number 2, there are the 2 antiviral pills that are available, one produced by Merck, one produced by Pfizer. And again, these are specifically for patients who have significant risk factors of progression of disease to very serious disease. Patients with pre-existing conditions like diabetes, obesity, cardiovascular disease, hypertension, chronic lung disease, immunosuppressive disorders or autoimmune disorders, and patients who are on treatment with immunosuppressive drugs, like patients who are on cancer treatment, who have had transplants and are on immunosuppressive drugs. Those patients are the patients specifically who are at greatest risk if they become infected of progressing to very severe disease and potentially death. Those are the patients who we want to get treated within that first 5 days, either with the specific monoclonal antibody or with one of these antiviral pill regimens to be able to stop the progression of disease. Now, if you're not in that category and you don't have significant risk factors, what do you do? What do you do if you start having these upper respiratory symptoms and you go and you get tested either from a testing center or by using a home test, and we'll talk about those in just a second, and you do test positive? Well, the first thing you do is you quarantine yourself. You want to try and get yourself out of the path of other people that you can then pass this viral infection on to. Whether you're at your home and quarantining in a specific part of your home, whether you are in the workplace and you notify your supervisor so that you can remove yourself from the workplace where you can transmit this virus, whether you are out and about. If you're the type of person who just has, gets stir crazy real easily by being at home, you're going to have to kind of bite the bullet. And for how long, you ask? Well, the CDC put out some recommendations for healthcare workers and frontline workers that if you've got mild symptoms and you test positive, that the quarantine period is recommended for 5 days. Well, I think that is pushing it a little bit, and I'm going to be honest with you. The reason why I say that is because even though your symptoms may be mild, the compliance with the masking rules that we're seeing around the country and around the world are so abysmally low that 5-day quarantine period only works in the situation where you're in an environment where there's strict masking and social distancing guidelines to help additionally decrease the risk of transmission. And when I say masking guidelines, I'm not just talking about a cloth mask or talking about a little face covering or even surgical mask. They've now updated the mask recommendations to either KN95 or N95 masks. And both people who are in that 6-foot range need to have that mask on. Otherwise, the masking no longer is effective. If only one person is wearing it, or if there's one person in a group of people who are in an indoor environment where social distancing is not necessarily something that is easily achieved, then the whole benefit of the mask is reduced significantly. Now, how do you know whether or not the masks that you have are the right type of mask? Well, when you order them, you want to look for either an N95 or KN95. Well, Dr. Ellis, I've also heard news reports that if you order masks on the internet, you may or may not get what it is that you ordered, and that's true. There's a bunch of scammers out there trying to make a quick buck. So once you get the mask, you do the water test. You take the mask and you run a little water in the inside of the mask. If the water leaks through, then that's not an appropriate mask. It's not effective at filtering out the droplet particles that will spread the virus. If it does hold the water, then you've got an appropriate mask and you can feel confident in wearing that one outside and in closed environments. So that's very important to know that water test because, again, you can't always judge a book by its cover. I hope I've answered some of your questions. I hope that if you have additional questions that I've not touched on, that you send me those questions through the YouTube channel. Remember what I said in the beginning. Click subscribe so that you'll get notifications when we put out a new video. Also, click like and let us know that what we're putting out here is stuff that is interesting to you. If not, give me ideas about what would be. I'd love to hear from you. God bless you.